Alex here, author of Straighten Up My Perfect Posture and a chiropractor at both Liverpool and Salzburg chiropractic clinics. Now today I want to talk about sciatica or sciatic type pain because we get asked daily whether we can help and treat sciatica and what the most common cause of sciatica is. Now, before we get into that, if you watch the video to the end, I'm going to run through two exercises you can use if you're suffering with any sciatic type pain. But it's important to know the differences and the different causes of sciatica first, okay? So, traditionally, you've got the sciatic nerve that comes from your lower back through your glutes down your leg, okay? Now, traditionally, sciatica was pain that travelled down that nerve pathway, okay? But more of late, it's been used as a diagnosis of pain that travels down the leg. It doesn't matter in which vicinity it is, okay? So when a patient comes to us and tells us that actually I've been diagnosed with sciatica or I suffer with sciatica, it actually doesn't tell us very much. It's not a diagnosis per se, it's just telling us that you have pain down the leg. And it's not, these days, it doesn't even mean you got pain along the sciatic nerve, it actually just means that you got pain in your leg. So, what we really need to get to is the actual cause of your sciatica, and there's 101 causes. That's an over-exaggeration, but there's a number of causes, and often there's not even one cause. There's multiple things going on, so there might be 2 or 3 things going on causing that pain, okay? Now, going on to sciatica, how you classify them, okay? So there's not a 100% rule, but there's a way that kind of tell whether it's less severe or more severe, okay? So if you've got pain around the lower back, hip and down to the knee, so anywhere above the knee, then it's more likely to be something, it can be to do with like the nerve root, but it's more likely to be to do with the soft tissue around your hip and lower back, or the SI joint itself, or lumbar facet joints, okay? So what I'm saying is that you might have trigger points in your TFL or glutes or your lumbar spine musculature, okay? Or you might have sacroiliac dysfunction or SI sprain, or the same with the spinal joints, being the facet joints, you might have some dysfunction, irritation, inflammation going on there that causes that discomfort. Now with pain, if it passes below the knee, down into your lower leg, into your foot, that still can indicate that it might be some trigger points in the muscle around the hip and SI pain and so forth, but it could also indicate that there's something going on more with the nerve root or irritation of the actual sciatic nerve, whether that's with the piriformis irritating the nerve or compressing the nerve, or some inflammation irritating the nerve root in your lower back, or even a disc bulge or herniation. Now, another piece of the puzzle is any neurological symptoms. So if you have any pins and needles, or maybe something like a numbness kind of sensation or burning around the lower back, hip or above the knee, again, this doesn't mean that it is a disc issue. It might be more that there's trigger points in the soft tissue and SI disc dysfunction and so forth, okay? But if you start to get numbness in the lower leg, and when I mean numbness, I mean the loss of sensation, so right around the foot or lower leg, that can again mean nerve root irritation or compression on the actual nerve as well. But if you lose motor power, so strength in the lower limb, so you might have some foot drop, you can't walk on your toes, when you extend your toes up towards you and someone pushes on them, you can't hold them up. This is likely to be something more severe, so the actual pressure on the nerve, being a nerve root closer or in your lower back, okay? And this can be caused by a disc bulge or even a herniation, or there's other causes as well, but it's usually more of a disc issue, okay? And that's more severe, and you actually need to go see someone immediately about that, okay? So just going through that again, if you're just suffering with pain and discomfort, mainly above the knee around the hip, then you can usually manage that yourself as well using exercises, stretching and soft tissue release techniques, but you can also see someone to help with those symptoms, but usually it's something a little bit less severe. If you can start getting pain passing into the lower leg, that gets a little bit more confusing because it could be the same issues, or it could be something to do with the disc in your lower back and actually compression and irritation on the sciatic nerve. Now, when neurological symptoms come into it, changing reflexes, loss of strength, changes in sensation, so loss of feeling, that is more likely to be compression of the nerve root, and that's a more severe cause, and it could be from a disc bulge, disc herniation, and so forth. Okay, so that's you need to see a professional to get that seen to, so you know exactly what's going on and how we can help that. Okay, now another thing I need to mention is if you get numbness in the saddle region, or you have bowel and bladder changes, incontinence, so you can't control going to the toilet, or you can't go to the toilet and so forth. That's a medical emergency. You need to go to A&E and get checked out immediately. Okay, that could be a sign of significant pressure on the nerves. Okay, so you need to go immediately for that. But if you're suffering with all the other symptoms, definitely come see us. We can help with that. Or if you're unsure about any symptoms, come see us, and we can give you the right game plan and make sure that you know exactly what's going on and what you can do about it. Okay, but if you do suffer with the pain, some of the neurological symptoms, then we can definitely the next two exercises are going to be perfect for you. Another giveaway of any disc issues is your posture. So if you have an antalgic lean, whether you're bent over forward and you can't fully extend, or you have that S-shaped posture where your hips are pushed out to the side and your shoulders to the opposite side, that's a good indication that there's something going on in the disc, and these next exercises will be perfect for you. But if you have loss of motor power, or you have any change in the bowel and bladder, or a numbness around the saddle region, then go see a professional first before you even attempt these exercises. Okay, and then if you're just suffering with pain around the lower back and hip, these exercises won't be for you either, because it's actually something else that's going on, and these exercises can actually aggravate it. Okay, so again, that's why we say go see a professional. And if you do and you know you've got a disc bulge, then these are the exercises you want to do. Okay, so I'll show you those in the next part of the video. So the first exercise you're going to do, you're actually going to lie on your front. Okay, and that might be all you do initially. Okay, but then you're going to place your hand underneath your chest, and you're going to slowly start to extend your back. Okay, so you're going to extend it to your tolerance. Now this might feel uncomfortable in your lower back, but as long as it doesn't increase the discomfort in your lower leg, that's fine, because actually what we want to do is bring the pain away from your lower leg, more to centralize it in your lower back. Okay, so you might feel a pinch and so forth, but that's fine. Okay, so first thing, you're going to lie on your front, and you're just going to relax in this position. Okay, now you can slowly start to extend up onto your elbows and hold it here, and then you can progress to extending your arms. And the ideal part, you're going to get to a full extension, and you're going to let your hips drop towards the bench. Now you're going to hold these positions for about 30 seconds. Okay, and you're going to do that every hour, once every hour. Okay, now the big test is, once you've done that exercise, you get up and you look at your posture, and if your posture has improved, so you've had a decrease in that S shape, or you can actually extend, then you're on the right track. Stick with this exercise, do it every hour, 30 seconds every hour. Now, if your posture hasn't improved at all, or it's made it worse, this is not the one for you, and you might want to try the second exercise. Okay, but if you've seen a slight improvement, great, keep going with it, and you should see even more improvements, even if it's only slight. Okay, but have a look at the second exercise, and then you can see which one works best for you. So the second exercise, if you've got that S shape, yeah, so where your hips are pushed up to the right, your shoulders are pushed to the left, or your hips are to the left, shoulder to the right, try this exercise. Okay, and again, once you've done it, check your posture. If it's improved, then stick with this exercise. If it's worse, or you found the other exercise got you better results, stick with that exercise. Okay, so if your hips are pushed out to the right, shoulders to the left, you want to stand up against the wall with your left shoulder. Okay, now if it's the opposite direction, change sides. So lean up against the wall, step away from the wall, and just let your hip drop, and try and push it in towards the wall. Again, like the first exercise, you might feel a little bit pinching around your lower back and discomfort. That's fine. Okay, as long as it doesn't increase the symptoms in your leg. Now you're going to hold it there for 10 seconds, and you're going to come out of that position, and you're going to repeat that 10 times. So it's 10 repetitions of 10 seconds, just pushing up against the wall each time, just trying to get your hip closer and closer to the wall. Okay, now once you've done your 10 repetitions, then have a look at your posture again and see if it's improved. So even a slight improvement, and then you can compare which one works better for you, whether it's the side flexion or is the extension. Now, once you find the one that works for you, do it once every hour, on the hour, and see how that improves over a day or two, okay? And that will help take the pressure off the nerve roots by trying to centralize them and centralize the disc and just remove that kind of bulge on the nerve roots, okay? Now, on top of this, I would always suggest that you go see a professional, because they can actually speed this process up and decrease your pain a lot quicker, okay? So that's my recommendation. Anyway, if you found this video helpful, like it, share it with your friends, and if you feel like you need to see someone and you think we could help you, then visit our website and get yourself booked in. We'd be more than happy to take a look at you and give you the right idea and the game plan that you can move forward with.